This is our presentation on how to say "Go Tigers." Helen is a 20-year-old Auburn student with an American English dialect who is showing her support by yelling "Go Tigers" at a football game. Today we will be discussing respiratory, phonatory, and articulatory anatomy and physiology, the syllabic overview of "Go Tigers," and then we will review. The major parts of the respiratory system are the upper airway, consisting of the oral and nasal cavities and the pharynx, the lungs and the pleura, the musculature, and the skeletal framework of the ribs, costal cartilages, and the sternum. Inspiration is the intake of air into the lungs, and it must occur to create the subglottal pressure necessary for speech. Subglottal means below the vocal folds, and the subglottal pressure is the air pressure in the lungs necessary to produce speech sounds. The external intercostal muscles contract, elevating the ribs upward and outward, expanding the rib cage. The sternocleidomastoid elevates the sternum, increasing the anteroposterior diameter of the thorax, and the scalenes elevate the top two ribs. The accessory muscles listed also contribute to the expansion of the rib cage. The diaphragm contracts and flattens, increasing the length and volume of the thoracic cavity. This creates negative pressure in the cavity. The pleura connects the lungs to the chest wall, so as the chest wall expands with the inspiratory muscles, the lungs also expand, creating negative pressure. Air flows down the pressure gradient through the upper airway and into the lungs. Elastic recoil is the thorax returning to where alveolar pressures are the same as atmospheric pressures, to pre-inhalation posture. Braking action is needed to slow the passive force of elastic recoil to allow the pressure necessary for speech, and is created by continued use of inspiratory muscles as voicing starts. Expiration is the movement of air out of the lungs during voicing, with air passing through the vocal folds to create sound. The inspiratory muscles begin to relax. The internal intercostal muscles reduce the diameter of the rib cage and pull the ribs down and in. The internal and external obliques and the transverse abdominis and the rectus abdominis muscles help draw the ribs down. The accessory muscles of exhalation also help with the compression and lowering of the ribs. As the ribs compress and lower, air is expelled out of the lungs through the upper airway and the vocal folds. Tidal volume is the amount of air that moves in and out of the lungs with each breath. For normal breathing, tidal volume is about half a liter. Female tidal volume is higher than that of males, and she will also take a larger breath in because she is yelling instead of just speaking normally. Subglottal pressure for conversational speech is 8 to 10 centimeters of water, and the pressure necessary for yelling is greater than 8 to 10 centimeters of water.
All right, so now we're going to discuss phonation. And phonation is the process of producing sound carried out by the vibration of the vocal folds. And these are the cartilages of the larynx, and they largely make up the structural framework for the phonatory system. And the vocal folds will attach to certain sections of the cartilages, making them important to the physiology of phonation. And these show just kind of the joint movements of the cartilages. They're important because they allow for sliding, rocking, and rotation of the cartilages that then affect the vocal folds, allowing for lengthening, tensing, and adduction. These are the major muscles of the larynx or the phonatory system. They will move the cartilages, which then affect the vocal folds, and then the thyroarytenoid muscle also makes it part of the vocal fold mass. Finally, some physiology. We're going to look at voiced versus unvoiced. This basically means that the vocal folds are either close enough to vibrate or they've been abducted. And what abducted means is that the posterior cricoid muscles have moved the vocal folds apart. This is for unvoiced sounds, and the voiced sounds are created by the movement of the adductors, your lateral cricoid muscle and the interarytenoids. And some more physiology. Transglottal airflow vibrates the vocal folds, and this vibration is known as the fundamental frequency, which we will perceive as pitch. Females generally have a fundamental frequency of about 180 to 200 hertz, so Helen will be on the higher end of this because she's yelling. Faster transglottal airflow will increase the loudness, and something Helen will again use. Phonation relies on the respiratory system to maintain subglottal air pressure for speech. In the case of Helen, like we said previously, she must have a subglottal pressure higher than 8 to 10 centimeters H2O for high intensity prolonged speech production. Because of this, her vocal folds will also have to be tightly adducted before phonation begins in order to allow the pressures to build, again, using the lateral cricoarytenoids and the interarytenoids. Vocal folds must maintain tension for higher intensity and frequency, so the muscles that influence this tension and length are the cricothyroid and thyroarytenoid muscles. Helen will majorly be using the cricothyroid muscle because she will be on the higher end of frequency. Smaller excursions of the vocal fold edge allow for a high vibratory rate, also influencing the loudness and pitch of the utterance, and then faster vibratory closure will increase the loudness of the utterance.
All right, next we're going to be moving into the articulation portion. So to begin, articulation is the process by which sounds, syllables, and words are formed when your tongue, jaw, teeth, lips, and palate alter the airstream coming from the vocal folds. The mandible is an extremely important part when it comes to articulation because our mouth is constantly moving while we articulate. The mandible is fused at the front out of fibrous synthesis and have many muscles that allow the mandible to move up, down, to the sides, and around while we are doing things like eating. The ligaments that control these movements are the temporomandibular ligament, the sphenomandibular ligament, and the stylomandibular ligament. The mandible has 7 main muscles that play a part in the movement of the mandible during speech that are allowed movement by the temporal mandibular joint. Other important factors that aid in articulation are the tongue, which has different parts that help us produce different sounds. The tip, blade, dorsum, and root of the tongue all have important roles by articulating with parts of our oral cavity to create unique sounds. The tongue has 4 intrinsic muscles and 4 extrinsic muscles. Next, the soft palate that elevates and depresses depending on which sounds we want to produce and the level of nasality in our production. It is important to note that the velopharynx is closed during the whole time while pronouncing Go Tigers because there is no nasality produced. Lastly, there are many muscles that control the shapes and movements that our lips can make while we are articulating. The orbicularis oris is a ring of muscle around the sphincter of the mouth, which can change the shape of our outer lips and bring the lips together, which can have a very big impact while producing the phrase Go Tigers. Next, we're going to move into more details about the articulation while pronouncing Go Tigers. So to begin, Helen begins by saying go. This sound travels right to left, meaning the pronunciation of O influences the shape she makes while she pronounces the G. This is also a contact assimilation with the co-articulation being in the same syllable. The G is not produced in a pure form because of the influence from the co-articulation. The G is a voiced consonant. It is also velar, meaning Helen uses her tongue and her velum to make this sound. And stop plosive, which is when there is an occlusion in the oral airway and a buildup of air behind the occlusion, followed by an abrupt burst of airflow released. As she pronounces the G, her vocal tract is constricted and her vocal port is closed. Next, she pronounces O, which is a voiced vowel. During this pronunciation, she has a mid-constriction in the back of her tongue, and she has a mid-level degree of lip rounding. Next, Helen begins the second word, tigers, by first articulating tie. This part of the word has a sound that travels right to left because the I influences the shape she makes when she articulates the T. The T is an unvoiced consonant that is the only unvoiced letter in this whole phrase. The posterior cricoid-arytenoid is engaged before producing the T to stop phonation since it is unvoiced, and the muscles of adduction engage after production of the T. The T is alveolar, meaning she uses her tongue and her gum, and stop plosive. While producing the T, the vocal tract is constricted, and the sound is acoustically less intense than the following sound of the I. Next, Helen pronounces I. This I is a diphthong and is actually pronounced more like an AI sound. This is a voiced vowel that has a pharyngeal oral airway that is relatively unconstricted. During this pronunciation, she has a high constriction in the front of her tongue.
When Helen continues the phrase yelling gers, the sound is categorized as a backwards co-articulation and right to left assimilation. This is due to the lip rounding preparing for the R sound before the G sound is made. This causes the articulation of the specific G to be different from the G in go due to the lip rounding and minor differences in tongue positioning. She begins with the sound g, which is a voiced consonant. This sound is a velar tongue velum stop plosive. During this sound, the vocal port is tightly closed and the vocal tract is significantly constricted. Next, the sound becomes a rhoticized E with a mid-degree of major constriction located centrally on the tongue. For this sound, the pharyngeal oral airway is relatively constricted with no significant constriction of the vocal tract. Finally, she ends with a Z sound, which is also a voiced consonant. This is an alveolar tongue-gum fricative, which is generated when air is forced at high velocity through a narrowly constricted laryngeal or oral airway. The sound is created with a tight vocal port closure and the vocal tract is significantly constricted. To review, production of speech relies on a number of systems in the body working together. Respiration provides the air and pressure required to support prolonged speech production. Phonation influences the air passing through the vocal folds, which helps increase the pitch and loudness of speech. Lastly, articulation is the final step, shaping the sound and influencing the way the sound is perceived throughout different articulations. And these are our citations.